Atherosclerosis is a buildup of fats, cholesterol and other substances, which we call plaque, on the artery walls. They are characterized by intimal lesions, which we call atheroma, where they will impinge on the vascular lumen and then can also rupture, which will lead to an occlusion. What are the risk factors? First of all, we see that age is a big one. The sex plays a role, where we can see that males are more predominant. Obviously the genetics, and because it's a buildup of fats and etc., we see that hyperlipidemia and hypercholesterolemia, especially with an increase in LDL, are present. And another one is hypertension and lifestyle choices like smoking, obesity, no physical exercise, etc. So how about the pathogenesis and the development? Now, firstly, the first step is an endothelial injury, which as a response, inflammation will follow up to. Then we will see accumulation of lipoproteins on the site of injury. Thirdly, platelets and monocytes will adhere to the endothelial and turn into foam cells and macrophages. We then, after that, see the accumulation of lipids and the release of inflammatory cytokines, which moves the whole step further and further until we see smooth muscle recruitment and their proliferation, and that is obviously followed by higher expression of growth factors of VCAM and ICAM, which speed up the whole process until we eventually have this atheroma in the intima of the vessel wall. So how about the morphology? We see two things. We see fatty dots and streaks. The streaks are a collection of foam cells, lymphocytes T, and lipids in the intima. And the atheromatous can be either soft plaque or is a soft plaque, and if it's a fibrofatty, as we call it, we can describe it as having a hard plaque. What are the complications? Clinically, the main complications is ischemic heart disease and myocardial infarction. And other ones are also ulceration of the atheroma, a rupture, a subsequent hemorrhage, a thrombosis, or also an aneurysm. And we also can see atheroemboli or cholesterol emboli. Thank you.